Hey, class. Good morning, or actually, it's morning where I'm at. I'm actually in San Dimas uh, at the very first MAT program graduation, for graduation. It was a lot of fun. Actually, the graduation is today. Um, but I had to sneak away this morning to record the lecture, so I won't be back in time by Monday. There's a couple of things I'm going to go over. Hopefully, if you guys, the music doesn't um, distract anybody. Um, I had to sneak away to a local Starbucks. Okay, I'm going to go over the case study instructions today a little bit more, and then I'm going to record another lecture right after this to talk more about the content, just of the material from the class. So this week, your first case study is due. We are going to have a live lecture on Tuesday. So if you guys want to hop on, it's not mandatory, but if you want to hop on just to ask more questions, get clarity, or just any general related questions, I will be available. Right. So first case study, what you're going to do is you're going to, it's 1 or 2 pages, AP format. What you're going to do is you're going to specifically look at the case study and look at which symptoms the client is showing. And I have a sample that we're going to go through in a little bit. You're going to go through the symptoms. Now, it's super important that you recognize DSM symptoms that sometimes translate in layman's language, because you're going to have a client that's going to come in and they're not going to say, I have hypervigilance, I have intrusive thoughts. They're going to use regular language. So, and one example of hypervigilance is I just feel like I'm always on edge, or I can't seem to settle down, or I keep having memories. So you just look at the case study and see if you can still look at symptoms of how somebody, like an average person, would describe it. Here's another example of hypervigilance. Working with first responders one time, individual said that he always had to sit with his back against a wall where he's watching the door. That's not a hypervigilant, is always looking at the front door. So it's good to know what the definitions of these are. So if a client describes them in layman's terms. Okay, so you're going to look at the symptoms, and then you're going to see if they meet the criteria for one of the diagnoses that we covered in class. Remember, and I'm going to talk about them more in detail today. We're just going to cover acute stress disorder, PTSD, or adjustment disorder, and vicarious trauma, which is a part of PTSD from somebody in the helping profession, a first responder. Even though a client is displaying signs of depression, maybe anxiety, you're not going to put that as a primary diagnosis. It's a trauma class. The diagnosis has to be trauma. Now, the depression or anxiety or substance-induced disorder or grief and loss could be a secondary diagnosis, but it's not going to be the primary diagnosis. Then what we're going to do is to see, so list the different diagnostic features, so criteria A, criteria B, criteria C, and actually plug in the symptoms that you're seeing in those criteria. Then you're going to have a differential diagnosis, something that you ruled okay, at a differential diagnosis, and then a diagnosis, something that you ruled out. For example, this client doesn't meet the criteria for acute stress disorder, but they meet the criteria for PTSD and why. So kind of expand the differential diagnosis and the diagnosis that you rule out. This is the way of just showing me that you're understanding the different diagnosis and the diagnostic criteria. And then any potential comorbid diagnosis. So this is if there's a client that has a substance-induced disorder. This is where we will include like depression or anxiety. Okay. And then the last is, oh no, and based on your assessment diagnosis, right, at least 3 treatment goals and intervention. After this, I'm going to record another lecture specifically going into interventions and treatment goals. So stay tuned for that. And then lastly is a spiritual integration. It's those some spiritual considerations, implications of the crisis and trauma from a biblical perspective. What does that mean? thinking about um, cultural considerations, spiritual considerations, a lot of times clients will have faith be a protective factor, something that is resilience to help them get through hard times. Another thing is a client might be angry at God, and their view of God or spiritual considerations actually causes more harm. Because, for example, if they think if God truly exists, why did he let bad things happen? So the case, of evil. You could also, one thing I want you to guys to get in the habit of is to do additional research outside of the textbook to understand um, cultural and spiritual considerations. So if you have a Hispanic client who represents as Catholic, do some research on the cultural upbringing and spiritual considerations and how that might influence or impact their uh, treatment, and then how maybe they are responding to a crisis or traumatic incident. Okay, and then if you just follow the rubrics, no, I actually do go through the rubrics, and this is how I grade. And so if it's good to just look at the rubrics as a guide. Okay, go ahead and hop on over to the second video for a lecture.